Alright guys, this is the chapter 4 section of the medical terminology portion of your curriculum that you're going through. Today we're going to be talking about prefixes. So some of the things that I want you to be able to do from this lecture is to be able to identify and define common prefixes used in medical terms, and analyze, spell, and pronounce medical terms that contain prefixes. Now there's a lot of prefixes here we're going to go over, so it's important to know these. A or an means no, not, or without. For example, anemia or apnea. Anemia is a blood condition. Without is what it directly translates to, where apnea translates to without breathing. Okay. Ab means away from, so like abduction. So you take away from. Ad, ad, is the exact opposite. It means towards or near. So like adduction means to bring together. So if you're looking at the human body right here, and you picture this, right straight up and down from your belly button as your midline, this would be abduction of the arms. You're moving your arms away from the midline. While this motion, bringing them back together towards your midline, is adduction. So that's one important one to know. Ana means up or apart, and anti means before or forward. Anti means against. So be very careful, guys. A simple change of a vowel at the end of that prefix change the entire definition. So like antibiotics, they fight antibodies, okay? Bi means two or both, like a bicycle has two wheels. Brady, the way I think about this one, guys, is like Tom Brady. He's slow, he doesn't get out of the pocket very often. He can't run very quickly. Brady translates to slow. Con means with or together. Sorry about that. Dia means complete or through, and dis, you'll see dis a lot. It means bad, painful, difficult, or abnormal, like dysfunctional, okay? It doesn't function correctly, it's bad. Ek means outside or out. Endo is within or inner. Epi is upon or above, like your epidermis is the outer layer of skin. It sits above your dermis. Ex means without, while extra means outside of. So be careful with these terms, guys. It's important to get them into your Quizlets so you can really study these. Hemi, like a hemisphere. It cuts the world in half. Hyper and hypo, you'll see all the time. Could be hyperglycemia, hypoglycemia. Hypertension or hypotension. Those are just a couple examples here, but hyper is excessive, too much, or above. Think of somebody who's hyper. Okay, sometimes they can get to be too much. Where hypo, like hypothermic, okay, your body temperature drops to below what it should be, or too little of what it should be. Okay, so that's the difference there. In means in or into. Inter means between, while intra means within. So know the difference, guys. It is important to know the difference. Mal means bad, and meta is beyond change or change or beyond. And you'll see this one a couple times throughout this chapter. Metastasis is the way you'll see it, which directly translates to beyond control. Neo is new, so neonatal is a newborn, okay, or new birth. Para is beside, near, along the side of. Peri is surrounding, so if you like your pericardium is surrounding your heart. Poly is many or much. Excuse me. Post is after or behind. So post is the opposite of ante, A-N-T-E. Pre is before. Pro and pros both mean before or forward. Quadra means four. Okay, you ride your four-wheeler or your quad. Okay, that has four wheels. Re is back or behind, and retro is also back or behind. When you see sub, think of like a submarine. Submarines go under the water. Okay, so sub means under or less than. Syn means with or together, and tachy is the exact opposite of Brady. Tachy is fast. So if you have tachycardia, you have a fast heart rate. If you have bradycardia, you have a slow heart rate. Trans is across or through, while tri, we have bi, quadri, and now tri. Tri means three, like a tricycle. Ultra means beyond, and uni is one. So some of the terms that we're going to go over now can't be made up of by medical terms directly, okay? And you need to know the definitions of them. So your adrenal glands are endocrine glands that are located above each kidney. What do you think they secrete? Adrenaline, okay? Adrenal, adrenaline. Antibiotics, they destroy or inhibits the growth of microorganisms such as bacteria, and antigens are foreign substances such as bacteria and viruses. So antibiotics are going to fight antigens. Here we go, bradycardia. I gave you an example of that earlier. It means a slow heartbeat or a slow heart rate. Congenital anomaly. Okay, a congenital anomaly is an irregularity in a structure or an organ that an infant is born with. So if they were born with some sort of deficiency or defect, okay, that is a congenital anomaly. Dialysis is removing harmful waste products from the body with an artificial kidney machine. You will have to go through dialysis if you go through kidney failure or end-stage renal disease, those types of things. Ectopic pregnancy. An ectopic pregnancy is an abnormal pregnancy when the embryo implants outside of the uterus. It's usually within the fallopian tubes, but sometimes on an ovary or in the abdominal cavity, and that is abnormal, guys. Parathyroid glands. There are 4 endocrine glands located on the dorsal side, so the back side. Dorsal means the back side. You think of a dorsal fin on a shark as the start that sticks out of the water, so it's their back side of the thyroid gland that functions separately from the thyroid gland. Prolapse is to fall or slide forward. It's often used to describe an organ such as a prolapsed uterus. And then retroperitoneal. Retroperitoneal means pertaining to behind the peritoneum. The kidneys and adrenal glands are retroperitoneal organs. Okay, they sit behind the peritoneum. They're not in that abdominal cavity. A syndrome is a group of signs or symptoms that commonly occur together to indicate a particular disease or abnormal condition. And then you subcutaneous. Sub means below, cutaneous skin. OUS is pertaining to. So subcutaneous is the lower layer of skin composed of fatty tissue. So it sits below the skin. All right. And then we have tachycardia, which is the exact opposite of bradycardia, is that your condition of fast or rapid heartbeat. Transurethral, okay? This is when an instrument passes up through the urethra. Your urethra is the tube that leads from your bladder to the outside of your body when you urinate. So this is a transurethral, is when an instrument is passed up through that tube. And an ultrasonography is a diagnostic technique using ultrasound waves to produce an image or a photograph of an organ or tissue. These can be done on babies or different parts of your organs to see if they're functioning correctly. If you have any questions, guys, over any of this information presented to you, please come up and feel free to ask me. Make sure you get these words entered into Quizlet, as they will continue to help you throughout your studies, and you'll be able to take that on when you leave this course as well. Keep working hard, have fun, enjoy this section.